it's Liz Calloway, and we're over at 360 Healthcare right on North Kings Highway in Myrtle Beach. And I'm here with Dr. Janine Rummel. She is an expert in, I'm going to need some help here, auriculotherapy.
You got it.
Auriculotherapy. Now, it seems to me it's all about reflex points, and some people are familiar with reflexology on your feet, but it seems to be kind of like the same premise.
Same idea. So just like we have reflex points on the hands and feet, we have reflex points in the ear. We choose the ear because it has the most nerve supply, so we can get a really good connection from those reflex points on the ear to the brain.
So if someone comes to your office complaining about some kind of neck pain or something like that, is this something that could help them?
Absolutely. This would work great as an adjunct to chiropractic adjustment, to acupuncture, to dry needling, to a lot of the other treatments that we have. It works really nice as a complement to the other treatments that we have at the office.
Can you give us an example of some other ailments that people can come in? So is it like more for chronic issues or sudden onset of some kind of symptom?
Sure. So we could be looking at something that's acute, that's only been lasting maybe a couple hours, few days, or something that's chronic, could be lasting months or years, especially when we look at doing something like a brain reset. We'd be looking at things like OCD.
A brain reset?
Yes.
Okay, tell us
a brain reset. So when we look at...
Everyone can use a brain reset.
Absolutely. Now. When we look at the ear, especially when we look at this portion of the ear, you can see the whole brain is right there, so really good. If someone has like OCD, ADD, ADHD, to be able to reset the parts of the brain that we are going to utilize as far as memory and our attention abilities, and how we tie emotion into those memories.
So this treats physical and emotional and things that are just kind of maybe misfiring in the brain as well?
Yeah, absolutely.
That's really incredible. Now, how is it that you do it? Do you use an instrument, or is it by manipulation?
Sure. So I use an instrument. It's using a small electrical current that most people barely feel, but it's strong enough. It's set at the same microcurrent that the nervous system functions on.
Do you like lay down? Like, how is it administered?
So they just sit for the treatment. Really, really comfortable. They just sit in a chair.
Okay.
I find specific points on the ear. I'm going to listen for the microcurrent to make a change in sound. That lets me know I'm on the correct point, and then they just sit there.
Hurt.
It does not hurt.
Okay, you sure?
I'm positive. It does not hurt.
And how long does it take to go through a treatment? How many
typical treatment, I'm going to use usually about 5 or 6 points on each ear. Typically staying on a point 15 to 30 seconds. So we're done within about 10 to 15 minutes.
And how many of these visits do you need to have before you see a change?
So typically if we're using these treatments in conjunction with something else that we're doing within a few treatments, I have some patients, they really like the treatments because they enjoy all the benefits of them, so it becomes a continual treatment. That's something that they just add, just like any other lifestyle change. They like the benefits of it, so they just continue it.
Well, you mentioned lifestyle change. Can it help with changing some behaviors as well?
Absolutely,
like
yes.
What?
Especially when we think of things like cravings.
Okay.
Right, so if people are trying to lose weight, or if they're just like really hooked on sugar.
What about smoking?
Smoking too, yes, absolutely.
How does that work? Because if you're physically addicted to something like nicotine or something like that, how does this?
But we also have a mental addiction too. So the brain plays a big role in all the things that we do physically as well.
So it's changing your behavior through tapping into these reflex points.
Yes.
Okay, I'm going to say it again. Auriculotherapy.
Yes.
And you are certified in this.
Yes, I am.
So it's a special piece of some kind of electric equipment.
Right.
Right?
The STEM Plus.
Okay.
This is the small piece of equipment.
All right.
Yep. And just this point on the very end is what touches those reflex points on the ear.
All right. So if someone wanted to call you, make an appointment for this to see if they're a good candidate for this, who do they call?
Sure, absolutely. They would call our office at 843-692-9243, and they would speak to Kathy, our new patient coordinator, and get set up for an appointment.
All right, and ask for Dr. Janine Rummel, and they're over at 4810 North Kings Highway in Myrtle Beach at 360 Healthcare.